Congratulations. I think we have plenty of time, so I can do my 2 hours presentation. I don't think that's any problem. No, I will keep it short. I was wondering, what should I talk about today? And there's a lot to talk about. I did research in Sierra Leone, did fieldwork, and came back a few months ago, and I would like to share some of the challenges and some of the joys. As we're talking about setting up a research unit, I think it's nice to share some experiences and some reflections on that. This picture was taken 4 years ago. Me and Peter were at a European conference on tropical medicine here in Copenhagen. And Peter had a nice poster presentation there. And then he said, well, this is my first scientific publication or scientific work. And now 4 years later, we are here, and he initiated this scientific conference. So I'm wondering what's going to happen over the next coming years. Håkon was, in the previous presentation, was explaining about the surgical program in Sierra Leone, where non-doctors were trained to provide surgical care and obstetric care. And the data he presented was gathered from logbook data that students and graduates are filling out. So we sat together and said, how can we go to the next step? As Lars mentioned, it's about increasing surgical access to surgery that's safe and affordable. And the safe part, the quality part, is absolutely something that we're interested in. So we said, let's set up a prospective study where we include a patient after surgery. So we discussed which surgical procedure would be most relevant. And as we know that cesarean section is the most performed surgical procedure in Sierra Leone, we choose that procedure. We discussed how to collect data. And one of the problems is if you rely on the data that is gathered in the hospital, it's of limited quality. So we decided to do home visits and visit the patients after the post-operative mortality time period of 30 days. So that's how we designed the study. And I would like to show you some of the experiences with this research. We calculated that we needed about 1,200 patients to put in the study, and this was a huge exercise, what we did last year. So in this study, 9 hospitals were included, where both doctors and surgical assistant community health officers were present, and the blue area show the areas where the patient, the district, or the chiefdoms where the patients were coming from. So this was really a national effort to follow up patients after cesarean sections. And if we talk about challenges, one of the major challenges is to find people back. We have phone numbers, we have addresses, but still there are many places where there's no phone coverage. There are many patients that don't have a phone themselves. Sometimes family members have a phone, so it is difficult to reach patients and ask their location. And most of the times you just need to go to the villages and try to find them during the home visits. But going to the villages is the next problem. How do you get there? This is a rainy season. And in rainy season, the roads are getting very bad. And this even, and in many places there are not even roads. So it's difficult to go there. In many places you need to go with a motorbike, and there are not always bridges. So luckily, we had 3 research nurses that were helping to collect doing these home visits. And one of them collected this made this video where he was going to reach one of the patients in the study, but it was impossible to go there by motorbike. He needed to put his motorbike in a canoe to go to the other side and continue his journey to reach. It's okay. To reach the patient. So just to give you an impression on how complicated it is to reach the patient and to follow up, to get proper follow-up data. Other challenges were cultural or cultural related. Often after a delivery or a cesarean section, the mother of the newborn moves to her own family and is difficult, and therefore it's difficult actually to locate them. And sometimes it's not obvious to find the correct location of the patient. And also the data collection in the hospitals is a disaster. Large piles of files, it's difficult to extract the information needed. But these are all practical challenges. I think I struggled even more with the more ethical challenges. So, first of all, who is benefiting from this research? Is it me, maybe hoping to get a PhD out of it? Is it the aim of this exercise? Is it the organization to attract attention and get funding for the project? Or do we manage really to benefit the patients in the end? And how are we going to do that? How do we make sure that the data we collected is delivered at the right place and published and has the right impact and will benefit the patients and the health system and the country in the really a difficult question. But also how to involve the local people, the community, how to involve local experts, local doctors in this, in all stages of the research. I think this is a really essential topic, and sometimes it's really hard and maybe theoretical, but absolutely worth the effort to work on. Is it ethical to use resources for research if you don't have money to provide even the basic care? Or in our project, not even enough money to run the hospital in Masanga. Is it ethical to use money to do research? On the other hand, you can also say, is it ethical not to do research? If you have poor resources, you need to know how to be effective. So you need to know where should I spend the money. Many money is spent on research in high-income countries, but very little is still used on specific on problems that are occurring in poor income countries. And finally, how do I prevent that research in a poor income setting results in poor research? And that relates back to all the challenges we saw. How do you deal with these challenges that it will not impact in the end the quality of the research? And I think that to be able to do that, you will need a research unit and you will need researchers that are committed, that are creative and trying to find solutions on all these problems. You need researchers that are very dedicated and willing to be prepared to face frustrations. But because that's very clear that if you want to do research in Sierra Leone, you will face frustrations and challenges. So I didn't want only to talk about the challenges. I also want to talk about the joys. And of course it's a great adventure to do research. And the biggest joy was actually to talk to the participants, to talk to the patients, to the research nurses, and to come into their houses and really hear their story. And those stories, I think, are the motivation to meet these challenges and to continue with this. What I wanted to show here is that it's so nice that what I really enjoyed was the different aspects of the work. You see the shoes that are in the mud. Some of the days you're trying to reach out to the patient, and your feet are getting stuck in the mud. Some of the days you're sitting together with the people in the Ministry of Health, discussing how this health system can be improved, how the research can have impact on the health system. And the other picture what I wanted to show was the surgical wooden shoes with blood on top. So sometimes you even have time to participate in the clinical work and to follow the whole spectrum. So this is the research team that I'm working with within Sierra Leone, and I'm really looking forward to get this research unit developed within Masanga and to work together, and I think this will be of great benefit. Thank you.